When I was being treated in the public system, it would have been very nice if the clinical staff had have referred me on to the rehab sector when I was being exited. I found out secondhand through a friend I'd made who also lived with mental illness, and I began to attend a day program. And then whilst at that day program, I was connected in with the Disability Employment Network provider, now known as the DES. Those connections were almost random, and there was no structure in place, unfortunately, that actually helped me do that. I got up off my own backside and did it for myself, which is not something everybody can do. So really, when you're being exited from an area mental health service, you should be given the linkages with not just the GP who's going to be treating you, or if you're fortunate, a private psychiatrist, but also the programs that exist at any given time that can actually help you continue upon the recovery path. Eventually, hopefully, the icing on the cake in the recovery path is back to some level of employment. When you start up a job, or in my instance, at one occasion I had 3 jobs. I was working up to 33 hours a week over 3 consumer positions. I was at an outreach service, a clinical service, and here at Social Firms Australia. Balancing, you'd go to a forum and you weren't quite sure which of the people you were working for and who was going to be paying your wage. Because both might have asked you to attend the forum, and you can't legally ask to be paid twice. It's not on. The pressures of doing part-time work in general, and this is not just consumer work, you often, to maintain a decent income, you may have to juggle more than one hat at a time, and these are stressors that living with mental illness, it can aggravate things. Knocking back one job because you've already said yes to another, even though you might prefer the other job. Having bosses getting upset with you because you've said no to doing something, but simply because you have to hold down more than one job, and each of the bosses is unwilling to give you more hours. The part-time work realm is hard for everybody, especially so somebody living with mental illness who may have time prioritising problems and struggle with getting up in the morning or whatever their issues are. Or like myself, I don't work well late into the night. I begin to get an afternoon fade out very early in the afternoon. I'm much better in the morning, which I'm told makes it unusual for somebody living with mental illness who are usually much better late at night. I don't know.